Now, Dr. Amma Edwin, who is a psychologist, also spoke to us about stigmatization of patients.
When we talk about stigma, we're talking about a group of people or an individual who is treated differently based on something we perceive as being other, something we don't want to be in touch with or associated with. And in this case, we're talking about COVID-19. So what is happening now is that we have patients who have been diagnosed with COVID-19, we have their families, we have healthcare workers who work in facilities, all being stigmatized. And when it happens like that, we end up labeling them, stereotyping them, discriminating against them, treating them separately, and then they lose their status in the society. Why is this happening? It is happening because COVID-19 is a new disease with a lot of unknowns. When it started in Ghana, it was seen as a burger disease, have-been disease, because it was those who had a history of travel who were having it. But now it is in the wider community, and so we need to look at it. The Honorable Minister highlighted some of the impact, and that is what we are seeing in the facilities. I work at the University of Ghana Medical Center, and so we occasionally have patients who come and are not forthright with travel history or history of contact because of stigma. I'll give you another example. A colleague shared with me that she had been managing a woman with hypertension with a group of drugs that can cause cough. Cough is a side effect of what we call the ACE inhibitors or ARBs. So in managing her, the doctor was trying to find out whether she's experiencing any cough. So she asked her, "Are you coughing and do you have any history of cough?" The woman said, no cough at all. So later on the doctor said, "Okay, when you do cough, let me know, because the drug that I've given you can cause a dry cough." Then he's like, "Oh, doctor, the reason why she didn't say so is fear of stigma. She thinks that once I have a cough, I'll be diagnosed with COVID-19, and once you have COVID-19, you'll be stigmatized. So how can we deal effectively with stigma? We know things that work for us, so let's look at a few. We need to build trust in our health system. Stigma often starts from within. All my life I've worked in mental health, and nowhere is stigma emphasized or stigma as real as in mental health, where even when you are a practitioner, I remember those days when, yes, 96, working at a psychiatric hospital. Even my husband, who was working in Kolibu, was stigmatized because his wife worked in the psychiatric hospital. But we also know things that we can do that can fight stigma. So having reliable information is one. We know that regularly the Ministry of Information, together with the Ghana Health Service, the Director General is here, update us with what is happening. So you have to have the know-how, and then we show empathy to people who are being affected. We have a saying that says that if you see your neighbor's beard on fire, you collect water, you fetch water and put it against yours. Not because yours will catch fire too, but in case yours catches fire, you have water to douse the fire. We have community spread. We never know who is going to get it. So let's be empathetic to those who have it, so that when you have it, the same way you treat others, you will get the support. But if you stigmatize others, next time it might be you. We also need to understand the disease, and that's why I'm so happy about the education that is being done in various languages. And then we should adopt practical measures that work. But
against COVID-19. My colleagues Edwin and Gloria have the liberty to chip in one or two, but I'm said it's the best repeating that it should not be business as usual. The media should capture the national mood and play a frontal role in the fight against COVID-19. Gloria, if, or Edwin, if there's any. Okay. Okay, I thank you. Okay.
Okay, so
And that was President of the Ghana Journalists Association, Dr. Roland Afil-Moni, urging the media to support the fight against COVID-19 by pitching in educating the public. He was one of those who addressed the minister's press briefing, which ended just a few minutes ago at the Ministry of Information. It was moderated, of course, by the Minister, Kojo Oponkruma, who began with an overview on government efforts in the COVID-19 fight. Major highlights there, the Director General of the Ghana Health Service, Dr. Patrick Abuaji, came to sort of clarify that information that was put out a bit late last night about the increment in the number of cases when it comes to COVID-19 in the country. He stated that the cases are 566 and not 1,064, as some persons put out in social media last night.